Hello, a good afternoon, I guess it is now. My name is Erin Ruggieri, and I am one of the marketing coordinators here at BCIT in the Health Sciences Department. And this is the Cardiovascular Perfusion info session. The majority of the session will be presented by Tammy Riley, our program head, who's on the call here. Also on the call from BCIT are Ambreen Sharif, and she is one of our program advisors. She'll be able to answer questions you might have. And Darren Ton, my other marketing coordinator, who's here for technical and moral support for me, I guess. So as we go along, I do ask that you keep your microphone on mute just to avoid any interference issues, but you're welcome to have your camera on or off. That's totally your call, whatever you're comfortable with. If you have any questions as we go along, please type them into the chat window that you'll see at the bottom of your screen. We'll try to answer some of those as we go along, and others we'll get to at the end of our presentation when we have a bit of a loud Q&A section. So before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. So our agenda today is a welcome and introductions. That's obviously what I'm doing right now. Presentation and program overview, some information on program advising and admissions, and then we'll have a bit of a Q&A at the end for any questions you guys might have. So I'm going to introduce Tammy now. Tammy, did you want to start us off right away with the poll?
Sure, let's hit the poll. Erin, thank you.
Okay. How many perfusionists do you think there are in Canada? Okay, I'm going to end it there. Share the results. Tammy, what have we learned?
Excellent. That 67% of the folks online are accurate. It's about 300 perfusionists across Canada. So quite a small profession.
I'll let you take it from there.
Great. Okay. So I guess our next slide. All right, so what is cardiovascular perfusion? It is the mechanical support of the heart and lungs during open heart surgery. In other words, the heart-lung machine temporarily replaces the respiratory and circulatory systems. A perfusionist is an integral member of the cardiovascular surgical team, and their role is to operate the heart-lung machine during surgical procedures. They're responsible for regulating and monitoring blood flow and safely administering blood products and drugs to maintain the physiological state of the body. Outside of the OR, perfusionists manage and troubleshoot ventricular assist devices, and they're also highly involved with ECMO, or extracorporeal membrane oxygenation. That's a tough word, Erin. Both VADs and ECMO systems are used to support patients who are in heart or respiratory failure. Next slide, please. So perfusionists are part of a specialized cardiac team and are highly autonomous in their role. So prospective students must be prepared to deliver acute level care and function well in fast-paced and high-stress environments. They also have to be willing to work long shifts and take call throughout the month. All candidates must have a bachelor degree and preferably a human science aspect to it. And there are two pathways for applying, which will be discussed later, but option one is available to RTs and critical care RNs. And the critical care RNs really need to be working in a OR, ICU environment or emergency care setting. So the program overview, the first year is delivered online and really requires 100% of your dedication to your studies. It's really time intensive and demanding. During the first year, you are expected to attend 2 one-week labs held on campus at the aerospace campus currently. And this is to help really foster the application of theory to practice. The final year is full-time and it's comprised of lab and clinical rotations across Western Canada. Within BC, there are 5 adult cardiac surgical centers, 3 within the Lower Mainland, and we have 2 surgical centers in Alberta, Saskatchewan, and 1 in Manitoba that BCIT is affiliated with. So students who graduate from our program are eligible to work across Canada, in the US, and other countries abroad. Currently, positions in BC start at approximately $50 per hour. And the Canadian Society of Cardiovascular Perfusion is linked at the bottom there. And I would encourage you to visit that site to learn more about the wages and the work environments across Canada. Currently, we have graduates working across Canada, the US, in the UK, and in Australia. So perfusion is a very small profession, and there are jobs across Canada, and as we mentioned, through the States and in other parts of the country. And Erin, I don't know if you would like to read the testimonial or you'd like me to.
Sure, I can do that.
Sure.
The testimonial from one of our recent students, now grad, Michael. He says, BCIT Perfusion gave me the expert knowledge and hands-on experience necessary to thrive in the fast-paced and high-stress environment of cardiac surgery, organ transplantation, and critical care. It's a pretty decent review there.
Yeah, yay, BCIT.
So we talked a bit about the program. Now we're going to talk about how you would get into the program, what the admission steps are. Tammy, did you want to do this one, or is this me?
I think it was you, but I can do it.
I have written those numbers and I can't see the numbers on my screen now, so that's just wonderful how we did that. So this program does open up just once a year for taking in students. So we take in students next date is September 2023. So the application period is currently open. It opened on October 1st, and we're going to close our application window February 28th. So you have until February 28th to get your application in if you'd like to attend this coming September. Some notes to be aware of. This is a highly competitive program. In 2021, we admitted 1 in 6 applicants for the perfusion program. So successful applicants tend to exceed the entrance requirements. The entrance requirements are the base, and then we look for people that have exceeded those. Successful applicants also show clear understanding of the profession. They've done their research, and they have experience working in some sort of high stress environment. So the application steps, once you decide to apply, is you review all the requirements and the application dates on our website. You convert all your documents to PDF files, anything you might need to use to apply. And then you complete a CASPER and mandatory questionnaire. CASPER is done on a website called takealtus.com. It's kind of test you can't study for. It's more of a personality profile to make sure you're suited to the profession. And then you apply online with all your documents at bcit.ca. So the required entrance requirements for this program. Do you want me to do this one as well, Tammy?
Sure.
So the required entrance requirements, as I mentioned, these are the base requirements, and we do look for people to exceed these. So first of all, of course, is proficiency in speaking and listening in English. So 2 years of full-time education in English in an English-speaking country. English studies 12, your grade 12 English, 73% at least. And then, as we said, there's 2 options. So a bachelor's degree along with card 1 on 1187, that's introductory stats for health. And then the option 1 is 2 years of current work experience as a certified respiratory therapist or a critical care RN. Or option 2 would be completion of the list of courses that we have there. So you can do your bachelor's degree with that list of courses, or you can do bachelor's degree with your work experience. And then, as I said, CASPER, mandatory applicant questionnaire, and some additional forms that are on our website. So as I mentioned, preference will be given to applicants with grades above the minimum of these courses, more experience than we listed here. Any post-secondary education that has a focus on human anatomy, physiology, or health is an asset. Strong and consistent academic performance shown on your transcripts. Recent and sustained work or volunteer experience that involve direct patient care, ideally in acute care settings if we can. demonstration of a clear understanding of the profession and the program, and excellent communication skills. So when you have your transcripts and your documents ready, you want to upload all those as digital copies. So you can scan or take a picture of your official transcript, or you download your digital transcript from your previous post-secondary and upload that. We do not recommend mailing in transcripts. We do prefer to do everything digitally now. If you have been a BCIT student in the past, we do not need your official transcript because we already have that on our file. So that's one part you can skip if you are a BCIT student. So once we get all of your documents in, the process on our end looks like this. So our admissions department reviews all the applications to ensure the requirements have been met. And then admissions forwards the complete applications to our perfusion department. So after the application deadline, the department shortlists and selects applicants. You get an acceptance letter if you're accepted, and then you pay the commitment fee to commit to coming to BCIT. So once you're a student at BCIT, we do like to, oh, and Breen has raised her hand. Perhaps she wants to add something to what I just said.
Yes, Erin, I just wanted to add that for those that have any courses completed at BCIT, I still usually recommend submitting the unofficial transcript as a PDF. And that sort of just gives the admissions office a heads up that those courses were completed, or those tests or challenge exams were completed at BCIT, so that they know to go and look on the system and look for those. But we certainly don't need the official transcript, just the unofficial is still recommended.
Okay, great, good to know. Yeah, I guess it makes sense to make sure nothing's missed. So this slide here about supporting your success. So we want to continue to support our students once they become students at BCIT. And I realize that a lot of your studies for the perfusion program are online, but even so, I want to highlight some of the stuff that we have at BCIT here. The first is our Indigenous services. They offer supports for students who identify as Indigenous, including a gathering place and information on funding that's available for Indigenous students. And then as well, funding is through our student financial aid and awards department. They have all your information on student loans and awards and aid that you can access. Accessibility services are available to students who might have either a short-term or long-term, temporary or permanent disability that might need accommodation while studying at BCIT. So you can connect with them once you're accepted, and they'll be able to tell you what kind of supports they can offer. Student health services, for when you are in the Lower Mainland on campus, we do offer a full service student health clinic on campus. It's kind of like a walk-in clinic, although you do need to make an appointment, as I know right now. But it's been a great asset for those of us who maybe don't have a GP or can't get into a CRGP as quickly as we'd like. They're a great asset for us on campus. As well as student health, just down the hallway from them, we have counseling and student development. So there is counseling available for all of our students who are registered with BCIT. And lastly, recreation services, because we can't forget about our physical selves as well. And they offer a full service gym, weight room with cardio machines. They have different fitness classes, intramural sports teams, all of that's good stuff. So if you have any questions going forward that we don't manage to answer in this presentation or in the chat, we urge you to contact Program Advising. They are a great resource here. They will help you with any questions you have about the application process, about courses that match up or don't match up. And here are their hours. And as it says, of course, they're subject to change, so do check their website before you come in. But they have telephone advising, Zoom or in-person advising, and email.
Yes, Erin, and for the drop-ins, we have both in person on Wednesday afternoons and a virtual Zoom option for visiting us as well. So there's some flexibility there.
That's great. Yes. So we would, now that you've heard a bit about BCIT and the perfusion program, we'd love it if you could keep in touch with us through social media or other ways. We'd love you to see kind of what's going on in health sciences at BCIT and what we've been up to, and we'd love to know what you're up to too. So we welcome you to follow us on Facebook, Twitter, Instagram, YouTube, or LinkedIn. And if you want to learn more about BCIT, there are some options listed there, including campus tours, if that interests you. And now I think we'll go to some questions and answers. Now I've seen lots of different questions popping up in the chat, but I haven't had a chance to read any of them. So before I get started with that, Breen, did you have anything else you wanted to add?
Nothing much other than the fact that we do get a lot of questions about equivalency of courses. So if you have a question about a specific course that you might have done, such as a medical terminology course, what I would recommend is sending us a course outline. So that would be a full syllabus of the course, and send a PDF to program_advising@bcit.ca so that we can get it reviewed. And that's if you've already taken the course. Otherwise, there are some recommendations under the entrance requirements of courses that are approved and that you can take to meet some of those requirements. We do have a few questions. One of them was regarding having a Bachelor of Kinesiology, Tammy. So I think the bachelor's, it doesn't specify what kind, provided the specific requirements are met, right, underneath option 2.
Yeah, that's right. And Breen, we do like it. Kinesiology would qualify for a focus in human sciences, but there is a list of required courses there if you don't meet the option 1 criteria.
Tammy, there's another really good question specifically for you on this one. Jeremy asks, does one need to have a strong stomach for this profession? I've never seen a patient's open chest cavity before. I'm not sure how I would respond to the sight of that in a real life setting. Any advice?
I would say probably yes, or at least attempt to, yeah. So I was able to watch an open heart surgery procedure because full disclosure, I'm not a perfusionist, but I've been learning lots about what they do. And yes, I would say you'd have to have a strong stomach for that.
That's a good answer. And I didn't know you had watched one.
Yeah, very exciting.
Oh, okay. Curtis is asking, does the degree have to be done full-time or can it be done part-time?
Sorry, does this program have to be done full-time?
Sorry, the program have to be done, yes.
Yeah, it's a cohort-based program. So when we look at our applicants, we take in a group of students and they move through the program together. Of course, we always want to support student success, and life circumstances do happen. And we have had students leave the program and then rejoin the next cohort. However, we do highly recommend that you start and finish the program with your cohort and move through that way.
So if I can take the question about the Bachelor of Science from India, from
Yes.
Judah. So yes, absolutely. But you need to get a comprehensive ISIS evaluation done as part of your supporting documents. And all the specific requirements still have to be met. And one of the things to check as well would be the English requirement. For those who've completed their education outside of a country where English is considered to be the primary language, there might be some additional English testing required as well. So those would be the things to keep in mind. Might be a couple of those courses that you would need to take from the option 2 list, and then getting the comprehensive ISIS evaluation done as part of your supporting documents, depending on the degree that you completed and the length of it as well. So definitely would recommend coming in and talking to program advising a little bit more, and we can guide you through. So that one, and then there was one before that we missed from Brandon about the Bachelor of Science in Health Science and a Master's of Science in Kinesiology. So in terms of credentials, you've got more than enough of them there. You just would want to make sure that you've met the specific requirements. He had a question about clinical training. He has research experience within an intensive care unit. Does this count as clinical experience, Tammy?
If you're in direct contact with the patients, yes, it would. And if you've also had a minimum of 2 years experience.
We have a question from Olivia that I feel like we've gotten every single time I've done a perfusion info session here. Tammy, maybe you can answer this. What percentage of accepted students are from each application option? Do we have more from option 1, more from option 2? What do we have a preference between the two?
We don't have a preference between the two by any means, and there is definitely a mix of students from both options. It might be weighted slightly skewed more towards option 1. Having said that, though, definitely we take students from both pathways.
Follow up to an earlier question, does the required undergrad degree need to be done full-time or part-time? Does it matter at all?
Prior to coming to BCIT,
Yeah.
that is entirely up to the student and is their journey.
Yeah, we just look at whether or not you have the degree, not how you completed it. So
exactly.
All good there. Lee has a question that I wonder if you could answer, Tammy. Let's just try this one. Lee's curious, the Michener Perfusion program just became recognized as a master's degree earlier this year. Is BCIT looking at doing anything similar?
That is a great question. And I would say that the program is very similar, that our program is truly probably master's level, I guess, study, I would say. But because of the provincial government within BC and Ministry of Advanced Education, I don't think that's something that we're pursuing at this time. So there's not like, there isn't a lot of interest from the government level to create master's programs or degree programs really at BCIT right now.
Great, thank you. Judah has a question and I don't know what it means, so perhaps you do, or we can just say that it says what?
I think he's referring to the IELTS academic stream as one of the possible English testing options to cover the English proficiency requirement and the 73% in English. So yes, a 7 overall score in IELTS academic stream is equivalent to 73%, which is the minimum requirement for admission for this program. In terms of being competitive, for these competitive programs, we always recommend the higher the better in terms of the grades. Maybe Tammy, you could speak more to that.
Thanks, Ambreen. Yeah, the program is extremely competitive, and the entrance requirements that are posted on the website are the minimum, and often our candidates exceed the minimum requirements. So, and you know, as I mentioned earlier, there's the program is very time intensive. It's a lot of work. So, you know, coming in with really good study skills and higher grades, I think you'll just be more successful in the long term. So, you know, it's a competitive program, so we do definitely look at the grades as well.
Evelyn has a question that I think I can answer right off the bat here. She's asking if the application window would end up closing earlier than February 28th if there were many applications being submitted. No. Once we set our application window, it is set. We will not change it and make it earlier. The only time we've ever changed an application window is other programs where we've extended it. We never shorten it. So no, don't worry about that changing. Brandon asks, is there a preference for in-province students versus out-of-province students, Tammy?
That's a great question, Brandon. So we are in annual intake currently, and alternating years, we accept students across Western Canada. So typically we have 5 BC students on an annual basis, and every other year we will accept 2 Saskatchewan, 2 Alberta, and a Manitoba student. And we have affiliation agreements with those provinces for students to come to BCIT. Having said that, if none of those applicants meet our requirements or don't meet the minimum requirements, we may accept more students from across Canada, if you will. Did that answer your question? Great.
He says yes.
Okay, I can take Justin's question about the university level English. So
Thank you.
yes, We do accept 3 credits of English, humanities, or social sciences at the post-secondary level from a recognized institution to cover the English 12 requirement. You just would want to make sure that you've got the 2 years in Canada or in a country where English is the primary language. Otherwise, some testing on speaking and listening skills might also be required. But other than that, so for instance, if you had done a history course or a political science course from, you know, Douglas College or a recognized post-secondary, that would cover off the English requirement, provided you have a B or higher in that course. Hope that answers your question.
Wonderful. Tammy, how many students are accepted into the program each year?
So we take between 5 to 10 students annually, or pardon me, not annually. We take 5 BC students. We have an exception this year where we agreed to take a Saskatchewan student. So we have 6 enrolled in the program. And then this intake coming up is our larger intake. So we will be looking at Saskatchewan, Alberta, and Manitoba students. So between 5 to 10, depending on the year.
If you do have questions that we haven't asked to answer today, or you have more questions that you think of after the presentation, you can always email program_advising, or we also have another email address specifically for perfusion. So if you want to email Tammy, you can email perfusion@bcit.ca. So if you have any questions about the program, about the career, those are best sent to perfusion. If you have any questions about admissions and how to apply, program advising. We do have one more question, and thank you to Darren for reminding everybody that a copy of this slide presentation and a link to the video will be sent out by email to the email address you used to register for the session to everybody sometime in the next week or so. But one more question from Caitlin. Does work or volunteer experience preferably have to be in intensive areas of care?
The short answer would be yes, but I know that with COVID and the current environment that it is a little bit more difficult to achieve. So just, you know, making sure that you have some kind of direct patient care volunteer would be good. It doesn't necessarily have to be in a high acuity setting based on the landscape that we're facing right now.
Okay, thank you again, Tammy. Thanks, Ambreen. Thanks, Darren, for being here to populate the chat. And I want to thank everyone for taking the time out of their lunch hour today to come and learn more about a perfusion program. And again, please do continue sending us your questions by email and keep in touch. We'd love to hear how your journey goes. Thank you.
Thanks everyone for attending, and thanks for all of your support.